Hello, welcome to KDR TV Live. We are very much privileged today to have very prolific mothers, our women in the community who are trying their level best to encourage the community to get vaccinated. COVID pandemic has claimed millions of lives across the world, and in the United States alone, over 500,000 people have died because of this pandemic. So the community, and by extension, some organizations have really come forward to demystify that COVID vaccination is not safe. Today we are having Dr. Judy Onduso, Sister Nema Mura, and Sister Elizabeth Marigi. They are going to expound a little bit more on their progress in ensuring that the community at large, and especially the African immigrant community, is vaccinated. Nobody should be left behind. So these prolific ladies in the community who have put a foot forward to ensure this is a success are now going to come to the show live, and we are going to have a broad discussion. Might not take long, but just a broad discussion, key pointers and areas where they think the community should ensure that it is a good pathway for us to beat the corona or COVID-19 pandemic. So let me usher in Dr. Judy Onduso, let me usher in Nema Mura, let me usher in Sister Elizabeth Marigi. Hello. How are you doing, ladies? Thank you very much. Thank you very much. Now, we are not going to waste any time. I'm going to give a brief intro. I'm going to give a 30-second each so that you can give a brief introduction of yourself to the KDR TV fraternity. So let's start from Sister Nema Mura. Give a brief intro of yourself, please.
Hello, everybody, our family, our community, and everybody else watching. Thank you, Ben, for giving me this opportunity. My name is Nehema Mura, and I work as a health unit coordinator, so I'm not new to the health field. And I also serve with the African Minnesota Women Awareness Group. So those are my names, Nehema Mura.
Thank you very much. Let's come to Dr. Judy Onduso.
Thank you so much for a kind introduction there. I'm Judith. I'm one of the nurse practitioners here in Minnesota. And I'm so thrilled for this opportunity for us to come together as a community and celebrate, actually, because with the global pandemic, it really shook us to the core. And to have this good news that we've had the vaccines that can help us to mitigate the problem that we have has been such a thrilling message to us. So I'm so happy here so that we can all learn together to demystify the COVID-19 vaccine. And I'm looking forward to all the questions that will be coming forth and trying to clarify and try to discuss with each one why we really need this, because we all believe in prevention is always better than cure.
Thank you very much. Thank you very much, Dr. Judith. Now let's go to our sister, our big sister, Elizabeth Marigi. Go ahead, sister.
So my name is Elizabeth Marigi. I'm a nurse here in Minnesota. I'm also a nurse instructor. I teach one of the nursing assistant schools. I work for AMAC as a communication director, and I'm thrilled to be here so that we can discuss about the vaccine. And also, if there's any question, we're here to answer any question that is going to come across, so that all of us can understand about the vaccine and the need to be vaccinated.
Thank you very much. So my first question, our first questions go directly to Dr. Judy Donduso. Is COVID-19 vaccine killing people or it's helping people?
Thank you so much, my brother, for such a good question. There's been a lot of myth out there, especially when the vaccine came out, and there were so many clips that were circulating talking about how most people were having a reaction to the vaccine. But when we go back to the most of the data and the research that a lot more people benefited from the vaccine itself. So it has helped a lot of people to have the herd immunity, and which is really something that is needed. As you can see, many of us who are in Minnesota, we are being allowed now to come out more. Some of the places are being opened because of how most people have been very receptive to receive the vaccine. So does it affect us? Do people die of that? I've not had a lot of cases about, a vaccine that has led to many deaths, but I've had a lot of good things about how the vaccine has enabled us to get back to slowly to our normal and also be able to open schools, get people back to work. And also, as a community, get together because we want to be together as a community. And this is what is going to allow us to get together to back to our normal.
Thank you very much. Before I go to Sister Elizabeth, there have been rumors out here that people are really scared to take the vaccine because they want. Some of them were really putting very weird analogies out there that when you get vaccinated, the next morning you'll wake up and become a monkey or become something completely different from the human race. So Dr. Judy, as a nurse practitioner and really treating so many patients who have also been infected or affected by coronavirus, have you seen anybody actually change? I mean, if somebody becoming like a dog or a monkey or barking, or has that happened really?
So, I think many people have said about that or they have had information about that. So many people I know have been vaccinated. They don't even complain of those side effects that people have been saying. I've not seen anybody who has turned a monkey or anybody who has turned a different shape. I could think that that's just rumors or just that people who want to discourage people from having the vaccine. But I've not seen anybody turning to be whatever people are thinking that they are trying to.
Thank you very much. Have you yourself taken the vaccine, Elizabeth?
Yes, I've taken the vaccine. We were the first people who got the vaccine last year. I mean, immediately came out. So many of my colleagues, so many people in the community that we are talking to, they are agreeing to take the vaccine despite what they have had. And they have very good information and there's many resources that people can read, especially from the Department of Health. They keep on sending out information about the vaccine, the side effects, if there is any, because the more we understand it, then the more we'll be receptive to take it. So there's a lot of resources, there's a lot of information in the community. Whoever has doubt can ask and they get the information.
Thank you very much, Elizabeth. Dr. Judy, do you have anything to add on top of that?
Well, I will. I mean, I totally agree with what Sister Elizabeth talked about. I was among the first people who were happy because it seemed like a Christmas gift for most of us when we heard that the vaccines were rolling out. Being the first responders, we were among the first people to get the vaccine. And as we continue this discussion, actually, we are going to learn that a lot of some of the, the soreness in the arm or some of the side effects that people sometimes were feeling is actually as a result of getting that inflammation that is actually supposed to happen when you are getting that immunity, starting to develop that herd immunity in your body. So an opportunity to get the vaccine.
Thank you very much. Now let's come to Sister Neema Mora. As an AMWAG liaison officer, what steps have you actually taken to ensure that the community is vaccinated?
Thank you once again, Ben. We are out in the community talking to people, sending flyers to every website we can, through WhatsApp groups, through word of mouth. We call people personally and encourage them to take the vaccines. And we have seen a good response. Although there's a lot of people that are still scared among our community people, but we encourage them, we tell them we have been vaccinated and we are okay. So it shouldn't be something to scare you, because a lot of things are going to be said out here about the vaccine, and they have been said, but we try to encourage people positively. So right now, any of our people that have not been vaccinated, we want to encourage you. We want you to know that you are better. It says prevention is better than cure. You do not want to wait up to the last minute. And I think that everybody, every household, or at least your close friend, somebody has been affected. People have died. Last year was a bad year for each one of us, and we'd rather get vaccinated to prevent this than wait to bury somebody. So please, our people, we encourage you to take this vaccine. This vaccine will help you to give you immunity, to give your children immunity against this the pandemic that has ravaged the whole world.
Thank you very much. A question to Sister Elizabeth. The community, when you are talking to the community to get vaccinated, is the community receptive? Are they accepting to be vaccinated, or there are some community members who are still resisting your request for them to get vaccinated?
So, as we are in the community, like we have already had some events, we have had some vaccination events, and we are having others coming. Some people are still having so many questions. Somebody was asking us, like, I'm told in 2 years, all those people have been vaccinated are going to die. And then they say, this is a research which has been done by philology. People do with miracles and all that in the lab and all that. So what we are encouraging them is that we are giving them information that we know. What we have read, what we've been informed by the Department of Health to say about the vaccine. There are some people who are accepting, but there are some people also who are watching to see what will happen before they take the vaccine. So it's not all our community members who are accepting. There are still resistance in the community about vaccines, and that's why we are outside here in the community trying to talk to people about it, and also giving them resources they can read, they can research, and also we encourage those ones who have like their primary doctors to call the doctors and get those education. So there are people still refusing, but there are also some who are accepting.
Thank you very much. Now let's go back to Sister Judy. Dr. Judy, I want you to passionately speak in Swahili because most of our reach is also from the East and Central African region, and some of them are actually, many of them are in the U.S., not only in Minnesota, but different parts of cities. I mean, I'm talking of the cities in the U.S. alone, North and South America. I want you passionately to tell the community why it's very necessary for vaccination. We've had so many vaccinations. When we were young, we were given polio. We were given, let me not start counting them because of time, but we've had so many vaccinations from when we were born up to now. So can you tell the community, ebu waeleze wenzetu, I'm not really very good in Swahili, but wewe ulisoma Kiswahili mzuri. nataka ujaribu kuwaeleza, I don't know whether they call it kinaga ubaga, waeleze tofauti gani tuko nayo na hizo vaccine zingine tuliweza kudungwa tulipokuwa wachache wachanga na saa hii. Tafadhali hebu eleza kwa kinaga ubaga.
Asante sana. Kwa kweli sijazoea kuongea Kiswahili, so nitajaribu vile ninavyoweza. Hii sio lugha ya mama. So but kwa kweli nilikuwa nataka kusema kuwa hizi vaccine ni muhimu kwetu sana. Sababu inatusaidia ndio tuweze mwili wetu huko unaweza I'm sorry, can I just go back to English?
Hey, I thought mimi peke yangu ndio sielewi Kiswahili, kumbe kupigana, kujikinga.
Kujikinga ya kutoka kwa hao magonjwa. Kwa sababu wakati tunaipata kwa mwili yetu huwa wanaweka protein ambayo ikifika kwa mwili yetu inaweza kujua, ama wakati sasa hiyo virus inaingia kwa mwili yako ina detect, inasema hii hasa hii ni kitu ambayo inaweza ingia kwa mwili wangu iniletee maugonjwa. So kitu inafanyika ni wakati umepewa hiyo vaccine, inafaa kurecognize hiyo virus ikiingia, so mwili yako inaanza kuifight na inaiweza hiyo wakati. So haimaanishi kuwa kila siku sababu hizi virus sometimes zinaweza kuwa ziko janja sana, but inaweza at least recognize, alafu unaweza hata saidika. Ni watu wachache sana ambao wanaweza pata virus tena wakiwa wagonjwa. Hatusemi huwezi kuwa mgonjwa, unaweza, lakini inasaidia sana kwa sababu inasaidia mwili wako kurecognize hiyo mapema, ndio upate kuifight mapema, sababu immune system yako sasa inaanza kufanya kazi haraka, ndio unaweza kupata kuifight. So ni muhimu sana, ndio maana tunaambia kila mtu ambaye anaweza aipate kwa wakati huu kama bado ingali inapatikana, sababu kuna nchi nyingi sana ambazo hazijapata hii nafsi ya kupata hizi vaccines.
Asante sana, umejaribu sana hiyo, umeongea mzuri sana. Sasa nataka Sister Marigi, because naona kama anataka kuongea hiyo Kiswahili mzuri. Sasa we mama pia, hebu jaribu sio kunongoneza, jaribu kutilia mkazo hiyo maneno ya Sister Judy ili wenzetu waweze kuelewa, kwa sababu kuna wengi bado wanashuku ya kwamba hii ni vitu vingine tofauti inaingizwa kwa mwili. Mara ingine itafanya watoto wetu wale bado hawajapata watoto wasipate watoto, ama wale watoto tutazaa hawatakuwa sijui namna gani. So hebu jaribu kutilia mkazo hiyo maneno dada yetu Judy ameongea. Elizabeth, tafadhali endelea.
Ya vile Dr. Judy amesema, ni kweli tumepata chanjo tangu mtu awe 9 months, awe mtoto, awe anakuwa teenager. Hizo chanjo zote, kila chanjo ilikuwa na maana yake. Kama ni tuberculosis ilikuwa na maana yake. Na saa hii sasa hii kuna circumstances hii ya COVID, ni kile hii virus tunapigania iko na COVID. So kila chanjo, kile daktari amesema, kila chanjo ilikuwa na maana yake. Na saa hiyo hata ikiwa tumepata hizo zingine nyingi, pia yafaa tupate saa hii, kwa sababu hii ya ugonjwa hii iko saa hii. So that's what we are saying. Even if we have had so many other things in the past, we have had them for various, conditions, but we need this one because of the current pandemic that we have.
Thank you very much. Sasa Sister Neema, wewe uko na wajukuu. Kwa group hapa mimi naona ya kwamba wewe ndio uko hata na wajukuu. Sasa tangu udunge watoto yako hiyo sindano kitambo, na wewe mwenyewe ulidungwa hiyo sindano, naongelea juu ya chanjo. Si vaccine ni chanjo Nimesikia Judy amesema ni chanjo. Yes, hata mimi sikuwa nimejua inaitwa chanjo. So hiyo chanjo uliona kama imeleta madhara yoyote? Tumesema kuna chanjo ya tuberculosis, kuna chanjo ya polio, na chanjo kadhalika na zingine. So we uliona kama ileta shida kweli? Hebu elezea wananchi.
Kwa kusema kweli, tangu tukiwa watoto tumechanjwa, watoto wetu wamechanjwa, wajukuu wamechanjwa, na ile side effects inaweza kuwa nayo ni ndogo kuliko vile ile madhara inaweza leta kwa yule ambayo hajapata hiyo chanjo. Kitu unaweza pata ni kama pengine joto kidogo kwa mwili, ama kichwa ikuume kidogo, mwingine anaweza hata tapika, lakini sijaona yule ambaye amekuwa na side effects ambazo ni mbaya sana, inaweza fanya mtu aseme hii siwezi fanya, hii chanjo sichukui. Vile nimesema, prevention is always better than cure. So I think these vaccines zinafanya kazi muhimu sana ya kutuchunga, ya kutuchunga dhidi ya magonjwa ambayo yanaweza kuwa na madhara makubwa kwa mwili zetu.
Asante sana. So let's go back to Kizungu kidogo sasa. Dr. Judy, we need you to at least tell the community also, we'll translate. We need you to tell the community some of the side effects you've seen or you've come across as a medical practitioner, especially on your patients. We don't want you to say this patient A, patient B, or whatever. Just give a brief on what you have actually seen after your patients have been vaccinated. Go ahead, Daktari.
So I was just looking here kwa sababu nilikuwa nimeziandika hapa, but
good. Go ahead, take your time.
But nitaendelea na nisema kwa sababu I can almost remember them. So most of the most common side effects tumesikia sana ni arm soreness. So when your arm is sore after the vaccination, and actually I had that myself. I felt a little soreness after the vaccination, but it actually got better after the second day. And that is because when I got that vaccine, there's some things in my body called cytokines. Those are the ones that actually start now producing that inflammation. So it is a good thing that you feel that inflammation starting. So that soreness, it's just supposed to tell you that, okay, it's just starting to work there. So there was also reports of headache. And some of the people who had the headaches, again, were allowed to, you could use the acetaminophen or the ibuprofen or anything that you use for your headaches. But most of us, we didn't really need to use anything. And so the myth that when you get those soreness and vaccine, that is a bad side effect, it's actually good. Because it makes us know that it's actually working. And because everybody's going to respond differently. Just because you didn't get the headache or the fever or anything, it doesn't mean like it didn't work either. It's just that everybody's body is going to respond differently. And then we did hear about, Malaysia, like kind of feeling like a little weak all through, or, fatigued a bit. But most of the symptoms, again, were supposed to resolve a day or two. Most of the people who had a previous allergic reaction, if they didn't actually know they had like maybe an allergy towards something like called the PEG, something that they put in sorbitol, or a medication called Toradol, because some of those agents were used in the vaccine. Those are the only ones that maybe will get like anaphylaxis, which means like they will have shortness of breath or are not able to breathe well. But I'm going to guarantee you that most people, when we were allowed to give these vaccines this year, the only place you're supposed to give this vaccine should be closer to a hospital. Or you are supposed to also have EpiPen closer to you, so that in case somebody, if you were the type who will have that, a reaction and you didn't know, you're supposed to get that EpiPen right away. And that really is saving people's lives. So I did hear about some of the, I think it was in the news where we had a few cases of Johnson & Johnson, where some people had like maybe a clot or AstraZeneca, where they had But again, those who have cloth busters, which have been able to be administered, which can be administered under the care. And that's why they were saying if we were going to give this vaccine, it should be closer to a hospital. We have about 5-6 hours to actually work on those clots, and those were able to really, get very effective. So those are very, very minor, very few people that had those symptoms again. So among other things that everybody was gonna say maybe an abdominal pain, and people had different explanation, but they had a day or two off from work if you needed that, and that is the state allows you to have a day off or so, and your work should allow you, and you should be paid if you get the vaccine and had a symptom like that. So nothing to worry, because this is a federal asset. So the federal is going to do whatever it needs to make sure that you get what you need.
Asante sana. So Neema, this is a question to you. Are you hearing or are you getting a feedback, especially from the community, that due to vaccination, your community members are safe? Most of them now can associate or can socialize freely without getting scared of any effect or getting infected from coronavirus. So are you getting any positive remarks or information from the community?
Yes, for sure, we are getting a positive feedback. I can see now people have begun assembling, people have begun having picnics, people are beginning to have more life and fun. And for sure, there is some people that did not want to be vaccinated, but especially the older people. And like one of my in-laws, but once she learned that I had been vaccinated and that I was okay, she actually came up when we were doing the vaccination at the Brooklyn Park Community Center. I was like, really? I was surprised and I was happy. She said, since you are okay, I believe I'll be okay. So we are getting a positive feedback. People are especially because those who have taken in our community, really nobody has had a negative effect. Nobody has reacted so badly to the vaccine. People are okay. So people are actually happy. They feel like actually this is going to protect us. So I think it's very positive.
Thank you very much. Okay, Sister Elizabeth, though uko mbali kidogo na kamera yako, tunataka kuuliza hii swali tena kwako. What's your projection, and are you having some dates for us? Anybody who is listening right now can definitely book an appointment to come and get vaccinated. So are you having any upcoming events for vaccination, courtesy of AMWAG?
Yes, African Minnesota Women Awareness is having, we've already done one event. So this on Sunday, the 6th, that's June 6th, 2021, we'll be at the Brooklyn Park Community Center. We're going to give the first vaccine. So anybody 12 years and above is welcome. Even those people have had Pfizer vaccine but have not gotten a second dose, they can also come. Also, we have on Saturday, tomorrow, also we have another group, Kenyan Nurses Association. They're also giving the vaccine. But for AMWAG, we are doing it on Sunday, so we are asking all the community members, pass a message to whoever you know so that they can come and get the vaccine. And I had one question when somebody was saying, sometimes when you see your people have getting the vaccine, like Mara is saying, that some people thought the vaccines were different. They thought they were vaccines for the white people and vaccines for the black people to kill them. But now that we have seen people are getting the vaccine, and I reassure everybody that those people are mixing the vaccine. They do not know it's for a black person or a white person. The vaccine is for anybody who is eligible to get it. So We have on 6th Sunday, we'll have the vaccination at the Brooklyn Center. It's a community center.
Thank you very much.
And then soon after that, we'll give the other dates. Once you get the Pfizer vaccine, we had already given the Moderna, and also we are going to give next week on 4th, we'll be giving the second dose of Moderna, and we are starting the Pfizer on 5th, and then we'll have another repeat in a month's time.
Thank you very much. Somebody who is watching here, Anauliza, after vaccination, will you also give some food?
Yeah, we are having some incentives, and we are having some incentives. So, well, just come, you may get some gift cards, some incentives to just so we welcome everybody come. There's something, of course, I know the community appreciates is giving a lot of food in the community. Yes, we will have something for you.
Thank you very much. Now you've heard, I mean, whoever is asking that particular question, yes, tell your community after vaccination, there's some little food. This is not an enticement, but at least the community, I mean, the AMWA group is really trying their level best to ensure that you get vaccinated, and possibly when you are getting vaccinated, there's some little food you can actually take and go and feed your family. So it's a great venture, it's a great opportunity for you to come get vaccinated and at least carry a bag of, I think you call it corn flour.
We may not have that one, but we are having some incentives. Just
okay.
Encourage people to come. We are having good things.
Okay. Thank you very much. They've heard from you. They have heard from the horse's mouth. So, Dr. Judy, before we ramp up this interview, there's one question I would like you to answer it from a technical point of view. I want you to explain what we mean by the term herd community. The herd, I don't know how to pronounce it well, the herd community. You try to explain it in English, and whoever has got the capacity to elaborate it in Swahili, please go ahead and help us here. So please, can you explain to the community what we mean by the herd community?
So the herd immunity is so when we actually born, most of us are encouraged to have even before you are born. Like if you're pregnant, there are times that they ask you to get a vaccine like called Tdap. That's the tetanus, diphtheria, and when we get that, what it means, like when the child is still getting the food through that placenta, you are still kind of passing some of those immunity to the child. And when the baby comes out and you are supposed to breastfeed the child, then you acquire that natural immunity from your mother as you pass it down in the milk. And when there are some of the things that cannot be passed down, like just because I had polio, I cannot be a vaccination, I cannot be passed that through the milk. So there are some things that don't pass through the milk or does not pass through the placenta. So we have to receive them later on in life. So like how we get the flu shot, or we get the tetanus shot, or we get any of those, what they do is those are called the herd immunity, because you acquire that and it becomes a protective that you receive from something that has been made. The vaccine, there are about one in the US, about 3. That is the Pfizer, and we also have the Moderna and Johnson & Johnson. Those are the most common ones that we are using right now. And among those, both Moderna and Pfizer require 2 doses, and in order for you to get that herd immunity. So if you got 1, it's not enough to have those mRNA protein that they put in that vaccine, that when it binds to your protein in the body, it brings that, it initiates immunity cascade, whereby now your body now starts to recognize a virus when it comes to the body. So that is what we call by herd immunity. So, and then for Johnson Johnson, you only get one vaccine, one dose of vaccine. So I've had people who maybe want to travel to Africa, want to go somewhere, and they are wondering, how can I just get one dose? Johnson Johnson is one of those that you can do one dose. And if you are around for Moderna, I think you can get about 2 doses, and it has to be between 24 and 20 days apart. So, but you can get it sooner than that, because then it does not work very well like it's supposed to work. And also for Pfizer, you can get 2 doses, but they have to be between 17 and 21 days apart. So if you are traveling or you have something coming up, make sure that you are choosing the one that is going to favor you right. And the reason they do that is because as they are researching this at the laboratory, they have to make sure that within this period of time, they can see that the cells are starting to work and they are able to fight a virus that is introduced to them in the lab. So this has nothing to do with a chip in for you or something in your system that is going to be preventing you from having children or anything of the sort. In fact, I don't even think they have a way to stop us from having children, because clearly even birth controls do not prevent us from having children. People still get children with birth controls. So I don't think they has a way to stop us yet, unless you have to do certain procedures which you have to consent for. So I do know that that's the much I can explain without getting very technical there.
Thank you very much, my dear sister. Elizabeth, unataka kueleza kwa Kiswahili ama tuulize wewe swali lingine? Herd immunity, yeah.
Sasa herd immunity ni ile tunasema watu wengi wakipata chanjo, tuseme kama ni COVID vaccine, watu wengi wasipata na wachache wakose kupata, itakuwa safe. Because majority, that's why they're saying, ndio tunasema ukifika like 80% of the population iwe wamepata hata hiyo Moderna ama hiyo Pfizer ama hiyo Johnson Johnson, then a small percentage hiyo haitapata, itakuwa safe. That's why we call it herd immunity, kwa sababu we'll get that immunity in the majority of people who have already had the vaccine.
Okay. Umejaribu sana. Si unaona wewe ni Mswahili bwana. Umejaribu sana. Okay. Because of time, let's go to the next question. This question is now again back to you. This question is basically coming to you because you guys, you are the one doing this vaccination. I remember back in the 90s when I was working for the World Health Organization, especially on the potency of the vaccines. We had very strict guidelines to ensure that when a vaccine is manufactured, wherever it was actually manufactured, I remember we were taken to Switzerland to be taught or to be shown how we are supposed to actually to ensure that vaccines are very potent from the point of manufacture to the point of administering. So nyinyi mukifanya hii kazi, or you guys when you are doing the vaccination, are those vaccines potent enough to ensure that whatever whoever is getting these vaccinations is getting a safe dose and is getting the dose which is going to help them? Can you elaborate a little bit?
So the way we are doing it, like we are partnering with Penfield County, we partner with the nurses and who come to give the vaccines. We work as a team. So what they do is we have a pharmacy. They have created a pharmacy within the place where they're giving the vaccination, because it has to be exposed at a certain temperature. So they have to get it, mix it, get it out, find out how many people are ready to be vaccinated. If there are like 20 people, then they are going to mix for 20 people and give it within the temperature is supposed to be given. So there's no making of the chain. because for those people who have broken the chain, like for Pfizer, they have to be re-vaccinated. There are people who have gotten like 3 vaccines instead of 2 because the vaccines were off temperature. And if they were off temperature for 5 minutes, then they are not going to use that particular vaccine. They are going to recall people back to get that vaccine. So they really monitor, they have everything, they have the coolers where they need to keep it, and then it's given within the time it's expected to be given. So there's no breaking of the chain.
Thank you very much. That is a good one there. Now, Dr. Judy, your last question. Are you seeing a decline? You know, you did statistics. For you to become a doctor, you've chewed the books very well. Now, I'm a mathematician, but I now want to put you into the task. It's a simple one. Statistically, don't worry, don't look over the roof, don't worry. I'm asking a very straightforward question. Statistically, from the patients during when we had the scourge and today, are you seeing a decline in the number of patients who are coming with COVID-19 infection or symptoms compared to when we had a lot of people dying and a lot of hospital beds occupied by patients who are having COVID-19? So can you tell the community, I mean, why I'm asking this question is just to encourage the community to understand that if they get infected, there are fewer chances for them actually to be admitted in the hospital. So statistically, can you give an answer based on my question, please?
Yeah, so that is actually a good question, because when you were saying, I was actually trying to look back on the units to think
okay.
what numbers we have here.
Perfect.
And the truth is, like here in the hospital, when we had the COVID cases, we actually had units which are called red units. Those are the zones that we had the ICUs, then we had to turn the beds that are usually regular beds to be red zone areas for COVID patients. And it has really declined. Because of course we are really, most of us are adhering to the rules of washing hands, using the masks and social distancing. Trying to not to stay with people who have been exposed for at least 15 minutes. So, and the vaccine, I believe that has also helped. So there are very fewer cases, but that does not mean that receive the vaccine not get it. Because as you have just said about statistics, data comes with time.
Yes.
There's things that are just because there's a correlation or a causation, we can now point that it's because some, like as Elizabeth was talking about the herd immunity that the people have acquired now sit together, we don't get to infect each other. It does not mean that you can just get away with that. The best prevention will be you protecting yourself and knowing that just consider yourself as you wanting to protect everybody. Get it. So the numbers have definitely declined, and that can be due to multiple factors. And it does, as you were listening to they were briefing us over the week. I don't know if you guys were able to watch the governor's office briefing us. We are still getting the variant from the UK. The variant does spread so fast, but the good thing is they have noticed that the people who have been vaccinated are not necessarily in danger. And the variant does not mean that it's killing a lot of people, but people are getting infected. So when you get infected, you don't know if you're going to be the one who's going to get the severe symptoms, or you're going to get the moderate or the mild. That is the thing we don't know ahead of time. So protect yourself when you can. Just because the cases gone down, it does not mean you should not get vaccine. It is actually a time to say, all get it, if we can.
Thank you very much. Thank you very much, Dr. Ari. So I'm now going to give you a 2-minute closing shots, each of you. Let's start from Sister Neema. Sister Neema, if you want to speak in Swahili, if you want to speak in English, 2-minute closing shot. If there is anything we left out, please go ahead and tell the community.
Oh, thank you once again. All I want to do is encourage our people to come get vaccinated, to encourage our people to get the prevention. There's a lot of propaganda going on out here, and I have seen some emails or forwards being forwarded that there's a Nobel Prize winner who is saying people are going to die after 2 years. Who wants to kill the whole world? I don't know. And when he kills the whole world, what is he going to benefit? This is propaganda. People should just shun it and don't even think about it. And please do not forward these things because I think they're also politically motivated. Just don't forward them. It's a big lie. It's propaganda. Nobody is going to die. If you are going to die, you are going to die from not taking your COVID vaccine. You're going to die because you're not taking the precautions you're supposed to take. You're not washing your hands, you're not using your masks, you're not keeping your distance. But if you get vaccinated, right there is the protection and the prevention. So please do not forward these things. All the propaganda that has been there since we start seeing this COVID pandemic, none of them has really been true. So from that, our people should know that this is propaganda and stop getting scared of taking the vaccines. And the biggest thing is, please stop this propaganda. Do not forward those forwards. Thank you very much.
Thank you very much. Sister Elizabeth, as you also, as you are also having your closing shot, few minutes, the 2 minutes, I also want you to tell the world, I need you to tell the community what is AMWAG and what you guys actually do to the community. So, ebu ueleze, hata kama ni Kiswahili Oswayo, muda ni yako.
African Minnesota Women Awareness Group is a non-profit organization which was started in the year 2015. We started 2013, but we came into operation in 2015. We create awareness in the community about domestic violence. We look for resources, we do referrals, and also those people are in need, we help them the much we can. We encourage, we want people to be together in families because families are very, very important. And also we encourage in case, there's just some misunderstanding in the family. There's always resources people can get. They can get counseling, they can see, the doctors, so that they get help that they need. So AMWAG also has been giving resources in the community. We've been doing food distribution. We did that through the epidemic, and we thank Henry County, the City of Brooklyn Park, and also the community stakeholders for giving us that opportunity to serve the community because they funded our activities, and that was great. And also with this pandemic, I want to say, please, stakeholders, community members, the church leaders, please tell people about the vaccine. Sometimes people listen to you because you are the pastor in the church. Stakeholders, people listen to you because you are a community leader, you are a community member. Our families, please seek help. Seek anything you don't understand about the vaccine, just ask. There are so many resources in the community and help us so that we keep this pandemic. We want to be safe, and we want to go back to the things we used to do. Remember, we used to go to parties, we used to go have graduation from our kids. Those things we are missed. If we get vaccinated, we want back to them and have fun.
Thank you very much. Thank you very much. Dr. Judy, if there is anything we forgot, my dear sister, go ahead, put it forward. And this is basically the start of a series of events, of a series of interviews or discussions with the AMWAG group. So go ahead, Sister Judy.
Yeah, thank you so much. I just wanted to shake Sister Nema's hand when she said, please don't forward these messages to people's WhatsApps and
Yes.
Every corner. They are not very helpful, and they are not even true. a lot of those things are just made up, and there's no information that is backing it. So, and I also think Sister Leta and the Amag group and in general what they are doing to really ensure that a country where sometimes most of the minority people are very disadvantaged, that we can also get some equality in terms of getting these resources when others are also getting the resources, fresh as it gets. So this is not actually a right, it's a privilege, because like other countries have not even been able to this. And so one I wanted to tell people as I finish this is, the truth is this: many of sometimes don't always know if we have any heredity or things that are happening in our bodies. You might walk and see, and you might feel that your body is going to fight the immune. But truth be told, many of us tunafanyanga kazi siku hizi, hata hatu exercise, hatulali vizuri, hatukuli vizuri, immunity yetu imeenda chini sana. Kwa hivyo mili yetu inaweza kuwa isifight vitu tunadhani. And as you can tell, the people who have gotten the disease, they end up with some of the side effects like lung scarring, fibrosis, the lung cilia inaanza ku shade off, so they have to regrow that. And you don't want to be the type of person who has to be, be with, end up with those side effects, because we really don't know how you will come out of there. So if we can prevent ourselves, we can do that. That's the best gift you can give to yourself besides living. Waking up each day and living. Give yourself that chance. Get what you need. Don't worry about the naysayers. They have their part, but you have a chance to protect you and your family and be there for the people who love you. So take a chance on this. Don't be waiting. Chances come once in a while. It might never be there tomorrow. That is what I would like to finish with. And thank you so much for this opportunity, Brother Kibwato, for allowing our community to view this and ask questions. So we'll take any questions if there is any.
Thank you very much. Not today. We'll definitely have to have another series. There are so many questions. We'll definitely have to bring you guys back so that you can expound more on the questions. But for today, thank you very much for accepting to come. Thank you very much for having an opportunity to elaborate some few key areas to demystify COVID-19 vaccine and many other stuff which we have actually discussed today. And for that, and for that reason, let me also take this opportunity to thank the president of AMWAG, Besi Mairura. She was not able to come because of our work schedule, but you guys, you've done your best. Wacha community wakuje wadungwe hii sindano ya vaccine. Watu wasiogope, wadungwe ndio tuweze kuendelea na maisha yetu ya kawaida. Si namna hiyo?
Na waambie hiyo Sunday at community center wakuje wengi.
Haya basi. Wameshasikia wenyewe. Watu wengi wanaangalia TV yetu siku hizi. So wamesikia namna hiyo na wataambiana namna hiyo mwingine kwa mwingine mpaka watu wajae huko. So watu wote wakuje wadungwe sindano. Asanteni mpaka wakati mwingine, Mungu aweze kuwabariki.
Thank you.
Thank you very much.